How would you like to lower your blood pressure by as much as 10 to 15 points in a matter of minutes? If that interests you in any way, then go ahead and stay tuned. Hey folks, welcome to Transplant Helper Today. My name is Jim Merle. If you're like I am and on occasion you suffer from a slightly elevated or a higher blood pressure, then like I am also, you probably do not want that to be a part of your life. As a matter of fact, a blood pressure that remains high over time can certainly increase your risk of stroke and or heart attack. Two things I don't want to have to deal with ever again in my life as a transplant patient. So if you want to do something to help to lower your blood pressure in a matter of minutes, in just a moment I'm going to give you one tip which will certainly do that. But before we get into that, let me explain to you that the American Heart Association always suggests on their websites as well as in all their material that there are basically no symptoms to high blood pressure. And I cannot disagree with that. They say that because they call it this silent killer. And that's because so many people live their lives every day with a higher blood pressure and simply do not realize it. But I will add this, that many of us who suffer with high blood pressures tend to attribute certain symptoms that we notice that are indicators in our lives daily as to whether or not our blood pressure just might be elevated. Things such as bloodshot eyes, such as red or hot faces, such as hands that are a little bit hotter than normal, and especially that pounding headache that occurs when mine jumps up or changes too quickly and moves up. Those are all indicators for me as well as many other people that my blood pressure may be high. However, the only way to know is to take your blood pressure, get yourself a manual or an automatic cuff, whatever you want. Take your blood pressure and track it so that you can really determine if it's high or not. And if you notice those numbers being higher than the normal average, which I'll try to link a chart below this video for that, then you need to go out and see your doctor and see if anything need to be done about it. But with that said, if you'd like to lower your blood pressure by 10 to 15 points in a matter of a minute or two, this tip will help you out every time, as well as probably make you feel a lot better anyway. And here's how simple it is. All you got to do to lower your blood pressure to that extent is to jump in the shower. And while you're there, go ahead, if you can tolerate it, turn the water up just slightly hotter than you normally would. Most of us, at least, would rather take a warmer shower than a cold one. And so if you're already accustomed to the warmer shower, just crank the temperature up just a little bit, being careful not to burn the skin and certainly to be sure that that water temperature is regulated. But crank the temp up a little bit and take yourself a hot shower. And if you do that, within a matter of about 5 minutes underneath that hot flowing water, your body's blood pressure can begin to drop by as much as 10 to 15 points, either on the top and or the bottom numbers. You say, well, Jim, how do you know that can work, and how in the world does that work? Well, medical doctors don't actually understand the whole science behind it, but basically what they've decided is that when you take a hotter shower, when your body temperature is raised to that extent, by that means, then basically your blood vessels, your capillaries, all the little veins and vessels in your body, as they begin to warm up, they begin to expand or dilate. And through dilating of those blood vessels, therefore the pressure within the inside walls of those begins to reduce and your blood pressure comes down. So as a result, if you're like I am and you can be sometimes symptomatic with a red face, with a headache, whatever, sometimes just taking that 5-minute hot shower can make all the difference in the world. And here's the real good part of that. Once you go and do that, maybe for about 5 minutes, get out of the shower, dry off, put your clothes back on very quickly, trying not to get cold in between. That lasting effect of that can last as much as a few hours. And so I think it's a big benefit and something we can all use if we need it, if we find our blood pressure to be high. Let me remind you again, I'm not a medical doctor, so if you really feel like your blood pressure has become high over time, without a doubt, your best bet is to go see your doctor. Let them treat that medically any way that they deem fit. And call your transplant coordinators, whatever's involved, if you see that to be the case. But if it's just a random thing that hits here and there like it does for me, jumping in the shower, a hot shower for 5 minutes, could make all the difference. I hope this tip has helped you out as well as any other tip I would give you on this program. If it has, how about go ahead and like, subscribe, and share this video out, and I hope that you'll gain much from it as I attempt to do what I can to both advocate, educate, and motivate you as a transplant patient. Again, thank you so much for being with me, and until next time, stay stronger, friends.